everyone, I'm Nidhi. I'm going to be your host for the second episode of Behind the Cause. Today we're here with United Pulse.
Hi, I'm Nishwant Goku. I'm the Vice President.
Hi, my name is Dia and I'm the Secretary, and it's great to be here.
Of course, let's get started. Can you share a moment that changed the way you think about healthcare access?
Yes, so when we first started with our research for healthcare access, our nonprofit is recent. So we first had to look at the cost for the healthcare kits. So our goals were to actually mainly make these healthcare kits with like basic hygienics, right? And then ship them out to areas where it's harder. And we thought we could maybe make a kit with like it should be around $5 to $10 ish, given that we're trying to ship it out to over like 10,000 peoples or communities overall in the future. And we didn't realize that like wholesale is not really easy for someone that's new, right? Because as a starter like nonprofit in high school, they don't recognize us as vendors, but rather just people that are day to day life. So it's harder to get with those bulk deals. And when that does happen, we end up overpaying. So our kits and tend to be around 20 to $30, which is it seems normal, but like when you look at the big picture, 10,000, it's going to be too much,
yeah.
right? So that's probably the main issue and challenge we're facing even right now.
Cost is a big issue.
Yes.
And why do you think healthcare access is such a big issue even in developed areas?
I feel like income inequality is the biggest issue since not a lot of people can afford the rising healthcare costs. And so that's why healthcare access is so important since this type of thing, everybody should be able to access, right? What do you think, Nishwan?
Yeah, I agree with her, and especially when she says income inequality, even if the area is developed, it comes to areas where people who move there are not all just rich, right? They don't have all the commodity, like the stuff they need to get there. There's
Different
still people,
income levels.
So there's still people at the lower side of income that are still in the developed areas that have a harder time reaching. I mean, they can afford it, right? But then they'd rather go to regular necessities like water, food, and like to sleep, right? So it's harder for them to get those like common needs that we think are common, but for them it's like a luxury.
Yeah. And what's one misconception that people have about healthcare access that you wish more people understood?
One misconception is whenever it comes to healthcare, people are like, okay, why can't they just go to a doctor? Like I've seen it whenever I talk to people when they don't get the term what healthcare necessarily means, right? And they think whenever we need healthcare help, they can go to a doctor or they can just go to a medical facility where they just, I don't know, hand them money or something to get those stuff that they need to help. But in reality, it's not how it works. They have to actually go to a specific center just for it. Yeah, do you want to add on?
And also, like, people think that just searching up their symptoms and getting it from Google is going to be the solution to all their problems. That's not what healthcare is about. Healthcare is just making sure that, like, you're getting the care that you need. And just going on Google and just trying to solve your problems through there might not always be the best solution.
Yeah, because, like, not all meds will help your one case, you know? And in your opinion, what does healthcare access mean besides health insurance?
So, healthcare access just means like the ability to get there, getting the care that you receive. And like it's not just health insurance, right? Health insurance can like cover some of the costs, but like they still need to be able to afford it even outside of the insurance, and costs can still be high even after the insurance pays like most of it.
Yeah.
And whenever it comes to healthcare, it's not just insurance because our entire goal is actually realistically not much about insurance, but it's about getting those necessities that people feel like luxury. That's the entire point. For example, a toothbrush for someone like maybe you and me today that are normalized will be like, okay, it's a normal thing.
Yeah.
It's a necessity, but for some people, they might go days or even weeks without brushing because they can't afford it.
Yeah. And do schools play a role in improving healthcare access?
Schools, I guess you could say, play the tiniest role because I guess they do have the nurses there, healthcare, some type of relation, but realistically, one nurse in one school
it's not really gonna save anyone, right?
No, it's not gonna spread. It's not gonna help anyone when it comes to the broader spectrum. But that's why our goal is to actually expand it rather than just keep it with one nurse per school. And obviously, they can't expand it by putting like 10 nurses at school.
It's just kind of like a requirement to have like medical assistants at a school but with a bunch of kids.
But not only that, some organizations do help. Like some schools like have like medical organizations that do have kids and do help the community. And that does help, but I still feel like we should improve the role schools play.
Even like taking initiative and teaching like students about how they can help with healthcare would also make a bigger impact of stuff like that. And if you could choose to remove one barrier preventing people from healthcare, what would it be?
So one barrier would be like rising costs. As I said before, lots of people aren't able to access it. and like basic necessities are still a bit too high for some people who don't have the money to. So that's why our like goal as an organization is to make these kits so like people don't have to worry about these type of things.
It's not just about the cost, it's also the main thing that we really want to change is the mindset, right? So the same thing, the luxury versus the necessity that we think of today.
Nice. What's one thing you wish every teenager or every person knew about healthcare inequality?
One thing that we wish that they knew is that you shouldn't genuinely just go out there and make fun of someone with the lack of cost or something that you have, but they don't, right? Most teenagers I've seen, even in the school that I go to currently, Rouse, right? If you go to someone else's house and you see them, oh my God, they don't have much towels, or they don't have much brushes, or they don't have clean clothes, or they don't have like bed sheets, for example, right? All of these, I guess they come under healthcare, but it's hard for them to get it, and most teenagers expect everyone to have it in the first place. But it's not that the person doesn't want to have it, right? It's the person that can't.
They can't have it, and it's like normalized for us because we grew up with it our whole lives anyway, right? So, does expanding healthcare always mean increasing the healthcare cost?
No, I don't think it always would be, since expanding healthcare would feel like there'd be more things to like involved. It wouldn't be as expensive. That's what I feel.
Yeah, and I agree with you on that. Same thoughts.
If we didn't put everything for a cost, it would be a lot easier to like promote healthcare.
That's the entire point of it.
Yeah.
It would be perfect. Like this would even need to be existing.
Yeah, like since there's more of it, the prices would likely be lower. So
yeah, we'd also all be healthier. So like, there's one. And starting this nonprofit, what's one thing that surprised you the most once you actually got to researching this issue?
So whenever it came to the researches, well, first let me just deeply tell you the cost, right? This is all about just the money, man. It's the cost that comes to healthcare, and the second research part is getting it out there. So even if I make the healthcare kit, we need to think about how we're gonna get it there, right? And it's not like, hey, I'm just gonna call an Uber and you can just take. It's not like that. It's like in rural areas, it's harder to get it there, no matter how much you try, because there's not just like a shipment of like helicopters going there every Friday that I can just throw on boxes. No. You have to specifically find the pathways. You have to specifically make a truck go there. And that's extremely hard. And that's something that we have to like really research on how to get the pathways. Because if we miss the pathways, maybe like hundreds or thousands of dollars that we put into kits are just
could go to waste.
Right? So that's the point.
Yeah, I was just genuinely shocked at how much research we had to do into all of this. Like, I thought like if we could get the packets, like things, we could just easily ship them out. But apparently not. We have to research every single thing that goes in. So like we're getting it all.
So like a lot of work has to be put in, right? Every single process needs to be like looked over. And last but not least, what's one change students or young people can realistically make right now to improve healthcare access in their communities?
So first, there's like really two things. One is like information. Everybody should know about different like healthcare, like how to access healthcare, like where to get the support that you need. Also just about healthcare in general, so they're not going into this without any misconceptions, especially when they're adults. And the second main thing is just like knowing when to reach out for help. Like, you know, supporting people, like maybe a friend needs like some help with something. So like not just like making fun of them, but like actually just supporting them throughout their time.
Overall, just reach out for help. It's nothing to be ashamed of or embarrassed of. I'm pretty sure anyone can go on Google to search up healthcare facility nearby or somewhere that they can call to and get some help. If not, obviously just call United Pulse. We got you. But still, anyone out there that needs healthcare, don't be afraid to reach out. That's the main cause.
Okay. Is there anything you'd like to tell our audience?
No, thank you for your time and getting us here.
Yeah, thank you so much for having us.